Mastitis is mastitis, right? Not quite. While it's tempting to treat all mastitis cases as equal enemies on the dairy farm, the truth is far more complex and interesting. Mastitis, the inflammation of the mammary gland, is one of the most common and costly diseases in dairy cattle. But here's the catch. Not all mastitis cases hurt us in the same way, and recognizing that difference can save your herd, your milk, and your money. Let's take a deeper look at how different types of mastitis can have vastly different consequences, and how a more refined approach, backed by science and smart management, can make all the difference. The pathogen matters more than you think. Mastitis isn't just one disease. It's caused by a variety of pathogens, and their behavior determines the outcome. Gram-negative bacteria like E. coli often cause clinical mastitis that can appear suddenly, but may resolve without antibiotics. In many cases, cows recover on their own with supportive care. Gram-positive bacteria, such as Staphylococcus aureus or Streptococcus uberis, are much trickier. They can lead to chronic infections, reoccurring inflammation, and even culling if not managed effectively. Experts stress that knowing the bacteria before treating is key to avoiding unnecessary antibiotic use and ensuring long-term herd health. Sometimes mastitis isn't obvious. In fact, subclinical mastitis doesn't show visible signs, but it silently reduces milk yield and quality over time. On the other hand, clinical mastitis shows clear symptoms like clots in milk, swelling, and fever. The severity of the symptoms determines the urgency and type of treatment. Cows with high somatic cell counts but no visible signs may still be suffering significant losses. Identifying the type and source of mastitis allows farmers to use a more targeted approach, reducing milk discard and treatment costs. Each cow is different. Her genetics, age, stage of lactation, immune status, and production level all affect how she handles a mastitis infection. A first lactation heifer might bounce back quickly with proper care. An older cow in peak lactation might suffer severe drops in milk production, requiring longer recovery or even early drying off. The importance of individual cow-level decisions, where tailoring therapy and using on-farm culturing helps reduce blanket treatments and improves outcomes. Sure, treatment is important, but smart prevention pays bigger dividends. From milking hygiene to dry cow therapy, bedding management to post-milking teat dips, every step matters. And when mastitis does hit, use on-farm culture systems to identify the pathogen and act accordingly. Not every mastitis case needs antibiotics. In the world of dairying, one-size-fits-all thinking doesn't work with mastitis. Recognizing the different pathogens, clinical signs, and cow responses helps you fine-tune treatment, reduce antibiotic resistance, and safeguard your milk quality and profits. Mastitis may always be with us, but how we understand, manage, and respond to it can make all the difference. So the next time a case pops up in your parlor, pause and ask, what kind of mastitis am I really dealing with?